forward to the. Hi, my name is Eileen Mendel, and I am CEO and founder of Centerpoint Vortex Strategies. And I'm here today with my guest, Terri Pena, and she lives in the Twin Cities and is a functional medicine physician. And she's also board certified family medicine doctor that has practiced over 25 years. And after graduating from medical school at UC Davis, she completed a residency at the University of California, San Francisco in Fresno. And then she continued her professional development with an MBA in medical administration from the University of St. Thomas, Minnesota, and has also completed a master's level health coaching certification from the University of Minnesota Center of Spirituality and Healing. So Dr. Terri, I really love your background here. You're one of the few physicians in the state of Minnesota who also has the certification for the Institute of Functional Medicine. And you were raised in California, and you spent some time in Abilene, Texas with the U.S. Air Force.
Yes, that would be a major, separated as a major.
So that's an interesting background. But you also, I mean, I see that you have a nice outdoor life. You like to go on boundary water canoe wilderness trips where they pack everything they need into you and your husband and your
we take our dog. Yep, everything we need to survive is kind of like how we encapsulate it. Throw it in pack it in a canoe, and then we shove off either at a lake or a river, and we go into wilderness.
Well, that's good. Let's get some fresh air connection with nature. So today, you're going to be discussing the latest in women's health care and the benefits of such things as weight training, the secrets to aging, as well as give us your take on self-actualization that would be integrated with the physical, mental, and mental well-being, so that there is a space with the whole body, where the whole body meets in health empowerment. And so today I would like to ask Terri a few questions so that we can all learn more as women over 50 about taking care of our health and the art of living. You call it the art of living intentionally, embracing the journey toward a vibrant and empowered future. I love that.
Yeah, yes. So, well, thank you. This is really exciting to be here and to talk with you and to share ideas and thoughts for women, and particularly with their health and well-being, because health is beyond just the body. It is actually kind of like who you are and how are you choosing to be and live. So well-being, even that word itself doesn't really encompass it. With a lot of our professional trainings and stuff like that, we talk about, Maslow's hierarchy of needs. And in that top peak need is self-actualization. And I kind of likened it to health wellness actualization. What do I need to live my best and be my best? And it goes beyond having a prescription for your cholesterol or your hypertension. And it goes way beyond just the annual exam and stuff like that. So I got called to interact or to focus in on women because that's who was coming to see me, both as an employed physician, but mostly in my private solo practice. And they were struggling with not feeling well and not getting any answers from the conventional world. They knew about functional medicine. They kind of knew about integrative care, and they knew they weren't going to get the answers in the conventional world. So they come to me and said, I'm tired. I can't lose weight, or I'm gaining weight and not sleeping well. I'm irritable. I'm moody. And what the heck is going on? And so we just sit down, I talk to them, and I really started to see the confusion and the lack of clarity and just not understanding what was going on, physiology, but also kind of life changes as well. When we get into our 50s, our kids may be older, we may be in our highlights in our career, and all of that will get changed or affected likely by all the hormonal changes that occur. And so because these women were not getting any answers and I knew I can help them and I did help them, I just was like, okay, let me dive deeper into this. I have my own personal journey with hormonal changes. And so going through that, I know I get the brain fog. I get that way. I get that. And I'm like, okay, wait a minute. I need to help myself. And when I do that, I'm like, I know how, yes, this is change is possible. We got to do things differently, but it's possible. And I feel my best now than I ever have in my 40s or 30s, because I'm deliberately doing things to focus in on my well-being. So kind of a little bit short story there of how I got here. Yeah.
Well, it is nice that you yourself have gone through some of these same issues so that you can relate to what these women are going through when they come and see you.
Mhm.
Now, how does functional medicine, how is that different from ordinary,
Conventional world.
practice? Yeah,
Yeah.
if I go to my regular physician, I'm not going to get the same kind of care then because
No, because the lenses are different and the training's different. So in the conventional world, the whole medicine grew up around trauma and acute illness and what's going to kill you. So people came to medicine because they had they had injuries, they had infections. Well, we learned how to deal with that, but the healthcare system had not evolved to accommodate that we don't have a lot of those urgent things anymore compared to the chronic issues with how do we take care of ourselves on a day-to-day kind of basis and maintain really good health. So the conventional world has a certain set of tools: medication, pharmacologicals, they have surgery, they have radiation therapy, and that's about it. And what they do is they look for symptoms and then they take those symptoms and they take, these symptoms go in this bucket and I'm going to label this bucket arthritis. I'm going to label this bucket hypertension and I'm going to label this bucket XYZ. And so then because I can label this a bucket, then I can send it to the insurance company with an ICD-10 code. But aside from that, now I get trained on what kind of medications to ameliorate the symptoms. So even though we had biochemistry training, and even though we did have some of these basic ideas taught to us, our training for the most part goes in how do we identify diseases, and then how do we help people suffer less from the diseases. It's rare that we resolve the diseases. Okay, so let's flip to functional medicine, which says that what's the root cause of why you feel the way you do. You don't have to have a disease. You can have one, but why are you tired? Well, that can be a million different reasons, but we put tired, we put things like that. And then we look at the body instead of looking at the heart or the leg or the nerve or the gut, the stomach kind of thing. We're going to look at systems. We're going to look at the whole body's connected. So we're going to look at the systems of energy. We're going to look at systems of detoxification. We're going to look at systems of communication. So in those systems transcends cell to organ to cell to organ because everything flows. An example, hormones. Hormones are chemical messengers that are made in one gland, sent out in the blood to go affect another gland or another organ. So how do you kind of class it? It's a system. And so functional medicine says, well, what's out of balance in this system? Can we find a root cause? What's pulling it and pushing it? What does the body need that it might be missing? What the body has that it doesn't and we need to take away? And how can we help the body heal itself? The body has this amazing ability to heal given what it needs and taking away what it doesn't. So functional medicine says, what's that root cause? Can we look at it through the lens of connection of systems? And how do we help that body heal? What I love about functional medicine is that person does not sit in just the body. So so you have a life. So what's gone on in your life in your past? And what's happening there? Who are the people around you? What's the environment that you're living in? And could that be causing imbalances? What are the things that happened to you in the past that could be contributing to imbalances? That could be an accident, that could be trauma, that could be a move that you didn't want, it could be a move that you wanted. And then also ask sort of the spirituality is, are you living your sense of purpose? Do you have sense of community? Those kinds of things. We know now that loneliness is at high levels and it contributes to disease and death. So that community, that connection. So again, it's all about the connections, connections to the root cause, connections to the systems, and you yourself are within a system. Where are things out of balance? Where can we move? Where can we shift? So it's this whole person, whole health perspective that I just adored and fell in love with when I first saw it. So now that's my frame. I can't not come from there. Let's put it that way. I cannot just limit this to, oh, only symptoms. We're going to give you a medication. So yeah, that's the difference. A little deep dive in that, but as you can tell, I'm a little passionate about that, about the power of having that lens and that awareness. Mm-hmm.
I can tell you are very passionate, and
Mm-hmm.
I think women love that kind of care where things are just not the superficial way that
Mm-hmm.
doctors traditionally would have you come in and say, "Oh, it's a gut problem, or it's a heart problem, or whatever." You know,
Right.
they look at the whole. You look at all the systems,
Or they come in and tell you that your labs are all within normal parameters.
right? And then they just
You're like, but I feel like this, doc. And they're like, well, you're getting older. Well, it's just part of aging. Well, you just need to accept it. No, 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 no. Yes, we are aging, but we don't have to accelerate the cost of aging by having issues that are out of balance or things that are dragging on the immune system or the gut health or whatever it is. If we can resolve that, then we can age powerfully and we can age intentionally.
so. Give me an example of a woman who will come into your office,
Mhm.
and what happens once they, come in and they say, they tell you, maybe they have a form or whatever, intake form, and they write down some of the symptoms. So how do you proceed to kind of dig deeper? It sounds like you have to dig a little bit deeper
Oh,
to
I dig
get
deep.
at what what actually is going on,
Yep,
uh,
yep.
how to
So
work with that patient.
So my first appointment that all my patients go through is what I call a foundational assessment, because the foundations are just that. They are the foundations. And there's huge amount of power in foundations. I tell my Hashimoto's patients that 70 to 80% of how they're going to feel is connected to what they eat, which is really powerful because they can really affect how they're feeling. And it's really hard because now they have to be responsible for what they're eating. Foundations are very similar. If we are not up to date or optimize our foundations, I can throw supplements at you. I can throw drugs at you. I can throw all of this stuff at you, but really you're not going to get all that much improvement. So my first appointment, foundations. We look at exercise. We look at nutrition. We look at stress. We look at sleep. And then we look kind of where are the basic supplements that you might be needing to help optimize. And so you talk about an intake form. Well, I actually do things differently. I work from a co-working space. So people always come in and go, what is this? And I'm like, it's a co-working space. They're like, that is so cool. And I went, yeah, I do things differently. So, I'm in a different space than a medical office. And so the platform to learn about them is something called Revelia DX, which actually is a very in-depth assessment to answering questions from a functional medicine lens. So when you fill that out and it talks about your birth and before birth and what's gone on, what are the things, in your health and your relationships, and then it brings that information and presents to me graphical representations of the 8 pillars of functional medicine: hormones, energy, gut, et cetera, et cetera. And then it gives me sort of a score of intensity of symptoms, the frequency of symptoms. And so now I get this fabulous graph that my patients love to go, oh, wow, I didn't realize I was out of balance here. But it also clues me in on where we need to start working at to help that person feel better. So It isn't a typical assessment that you fill out or type in, and then I get it and I look at it 5 minutes before you come in. It takes you a while. I just say, you can always come back to it, but yes, then I have them go get in-depth labs. I'm reviewing the form that they filled out, the labs, and then I'm already starting to bring together ideas and thoughts. Now we sit down. We sit down for at least a 90-minute, and I hear your story. I want to know about you. What brought you in? What's going on? And through that conversation, I will see things that are often missed or have been dismissed.
Mm.
Now I'm like, aha, okay. I have labs that say, okay, here's where things are. In the labs, I look for nutritional deficiencies. I look for cardiovascular risk. I do an in-depth lipid analysis that most doctors don't do. It goes far beyond the common annual exam lipids. I do hormone now, I'm looking at all of these things. So I gathered this in-depth lab, this in-depth assessment, and I'm going to talk to you for 90 minutes and I'm going to say, okay, all right, I'm coming to ideas, I'm bringing things together. And in that conversation, we're going to know what those next steps are. But we're also going to say, okay, I can put down all the list of things for you to do, but I can guarantee you're not going to do it. And I don't want to set you up for failure. So what's that 10% that you can do? What's manageable for you? I don't want anything on this recommendation that's going to be overwhelming. If you feel like it's overwhelming, and then we're going to take it off, because if it's overwhelming, you're not going to do it. So what feels doable? And then we talk about the negotiate about, well, what is exercise for you? What is nutrition for you? What is sleep? What is stress? How do you manage it? Can I give you, so all of those. And then they're left with not only this report from Revelia DX about their imbalances, but now they have recommendations about what their foundations are. What are those gaps? So a chunk of my patients go, this is wonderful. They take it and then go live their awesome life doing a little bit of optimization. For those patients who have things that we've discovered through that, what I call the red, yellow flags, or they're like, they've worked on this for a month or two and they're not getting better. I invite them into, well, let's start to optimize your health. And I have a framework for that I've distilled now for, I don't know how many years, but it is the essence for women, especially over 50, focused on 3 things. And I call it my 3M pillars, or my 3M methodology, but it has 3 M's in it. And so the first M is muscle, or excuse me, metabolic health. Okay. Number 1, it's always metabolic health. So when I talk about metabolic health, I'm talking about your glucose, your sugar, your risk for diabetes, but I'm also talking about cortisol levels, your stress levels. I'm talking about your thyroid health, and I'm also talking about your sex hormones, estrogen, progesterone, and testosterone. Testosterone is often missed for women, and it's vital. So for the women who can't sleep, who are irritable and moody, and they kind of have irregular cycles, they're in that peri, my first guess is that their progesterone has now dropped. Now, progesterone is one of those hormones that need to be taken by mouth so they can get to the brain and calm the brain down. That's what progesterone does. It calms your brain, among other things, but it helps you sleep and calms anxiety. So if a woman's anxious, and I'm like, might be some hormonal things. There could be cortisol things, there could be lots of things, but I'm always thinking, what are the connections? What are the possibilities? So that's a metabolic health. We're going to look at that, do deep dive. We may do some deep functional testing within that, and then we're going to start working on what that means. And then we're going to layer in that second M, which is muscle, which is, you're like, muscle? And I'm like, yes, muscle is that metabolic magic, because muscle is where your glucose is going to go into with normal physiology, day-to-day activity. And that muscle gives you strength. That muscle is what's going to help you metabolically, but also move in the world. And it will stabilize your joints, so your joints are not as fragile. And if you were to fall, which I don't want any woman to fall, you are likely to be less injured with lean muscle than if you don't. So cachexia is the medical term for people who don't have enough lean muscle mass in their body. And you are a higher risk of what we call mortality and morbidity. So bad things happen that include death if you don't have enough muscles on. Because if you don't have enough muscle on, that infers a fair amount of metabolic issues, health issues, and other things that have contributed to the lack of lean muscle. So what do? You get lean muscle. You use resistance training. So it's not just exercise, and exercise is that muscle, but it's the mobility, it's the stability, and it's that range of motion. Muscles we have type 2 twitch fast fibers. If we don't use them, they tend to go away. The brain goes, oh, I don't need that. I'm not going to waste energy and innervate that. I'm going to ignore that because it's not being used. That's what the brain does. Unfortunately, though, if we start to lose our fast twitch, we no longer will have that sharp capability to catch ourselves if we fall. To get our feet down into the stairs, to be able to, in maybe ambient lighting, be able to do what we need to do. We need those fast twitch. We got to exercise them. So muscle incorporates to me kind of that physicality of the risks for women that we tend to accumulate over time. And when we pull on resistance training, we're pulling on our bones. And when we're pulling on our bones, we're making them strong. Osteoporosis is a health threat for women. Bottom line, no women should suffer from osteoporosis. And if you have thin bones or are worried about thin bones, please get tested and get something done with that. There is some hormone replacement therapy aimed just at thin bone prevention, beyond the hormone replacement that we often think about when we talk about HRT. So that is my second M. And then we go into that third M. The third M is mojo. Because so when we get, past menopause and stuff like that, I have women say, I don't know what's going on. And I lost myself. Where am I?
Yeah, you lose.
Yeah, where'd I
Right,
go?
you lose you are like, I'm not the person I used to be.
Not the person I used to be. And how do I get that back? And that was my aha with my own personal story. I was sitting in front of a woman, listening to it and making recommendations and stuff like that. And there's a voice in the back of me said, that's you. And I looked at it and I'm like, okay, what? So, and finished with her. And later on, I'm thinking about that. I'm like, oh, that was me. What? And then I realized that sense of mojo, that sense of drive, that sense of aliveness that goes, woo, the day's great and stuff like this. I had lost a bit of that. And I'm like, oh, yeah, hormones. Okay, let's see if I can't do this. So went on hormone replacement therapy, getting it back. Years go on, and now I need to layer it up. I need to optimize it. But it surprised me, and it shouldn't have. But my own experience was it was a subtle change. It wasn't a big change, but it was a subtle, but it was a significant change. And it had to do with how do I present myself to the world? How do I show up? And I want to show up in a way that makes changes for other people, not just myself. But I have this mission, if you will, to get them know the whole idea of women over 50, that their health is huge. And it's more of, can you do your job? Can you live in the world the way you want to, that you visioned, and all these other things? And I'm like, yeah, I feel so much fabulously on hormones that I'm going to keep these. Not every woman can go to hormones. I get that. And we can work on optimization on those other things. We can help get those mojos, and we can definitely work on muscle, and we can definitely work on metabolic health. But those three pillars tend to be the pivotal areas, not only for long-term, short-term health, but also for that preventative long-term, that at 85, they don't end up feeble, frail, and forgetful. And I don't want any woman to be feeble, frail, and forgetful. I saw my mother-in-law be that way. I saw my husband's ex-mother-in-law be that way. And it just broke my heart because that's what they died from. And so that is sort of, it's my, metabolic, my muscles, and my mojo. And that's what I want all women to have really great everywhere. And that's what I'm working on today.
So a lot of women are in denial. I talk to a lot of women about, I've been diagnosed with some osteoporosis myself.
Mm-hmm.
And I said, have you gotten checked? They go, oh, no, I don't need it. I don't have they're in denial.
Yes.
So they
Yes.
don't even want to know.
Yes.
Or let's say, something else is going on. Your memory is not And they're just say, you're forgetting things, whatever. Oh no, I'm not, I'm okay. I mean, there's a denial factor also.
Yeah,
How do you overcome? I mean, some women won't even go into the doctor because they don't want to hear about,
right. Yeah,
anything
yes,
that's
yes.
negative.
There will always be the set of patients or people who the whole idea of aging is just too much for them. So they can't even go there. The whole idea of having vulnerabilities is, again, yeah, maybe, but not now. We also sort of culturally set up women to not pay attention to those things, in that, when we have kids and we raise these kids, it's all about them. I mean, kids born, they're needy. That's all they are, is need, right? So we sacrifice, we raise them, and we do all that. And for women, they lose that ability, or that consciousness, I should say, because they have the ability. It's that consciousness that I need to take care of myself. And so that gets not even on the list. It's somewhere on the floor. It's not even on the to-do list. It's somewhere not even there. So we need to put ourselves back on that to-do list. And culturally, that isn't always recognized or encouraged. And so that sort of feeds into another idea that's come across, which is, after we end our abilities to reproduce, to have babies, we are postmenopausal, our value seems to somehow lessen than before. And if a woman was in the corporate world, I'm guessing not alone. Maybe some of them are gray, some of them are not. But then, are you really your best? And men are like, yes, I have gray. This is great. I'm in my 55th year and I'm just getting started. And everybody cheers them on. A woman who says I'm 55 going on 60, they're like, well, are you going to retire soon? So the
Right.
expectations of the productivity for women, I'm just kind of showing what I think is what's going on, kind of what my gut instincts are saying. And so, it's these cultural things, these physical things, and then these are all our own learned. We don't care about ourselves in the same way. So they all kind of come together and feed together, that if we started going into territory that feels scary, that feels threatening, a lot of us are just going to pull back. That's understandable. So the one, for anybody who's like, I don't want to, I don't, I can't, it's like, okay, I understand that. It sounds really scary. What about this that, worries you? Well, and you just be curious about the questions. You be curious and see where their lens is coming from, and over time, hopefully they can start to change. But the reality is, some people will never be able to face that. And there are people who, with a little encouragement, can step up to go, okay, now I'm ready to work. They need a lot of support. They need a lot of encouragement and handholding through the change process. And then there are women who innately go, I don't like this. I don't want this. Wait a minute. What do I need to do to change this? And that's a spectrum for all of us, men or women. And so, yeah, there are those out there, and I wish they weren't. I wish I could change them. I would, part of why I'm going to be writing and why I'm doing this now to this level is to encourage those to take care of themselves, to look at the things that are scary and plant seeds. So if, at one point they have a little light bulb and now they choose a spinach over a pizza, or they choose a salad over this, those are positive steps. The steps don't have to be big. The step doesn't mean I'm taking everything out of my, pantry. I'm going to exercise 5 hours a day. I'm getting a personal trainer and a chef and all. It doesn't have to be that. Every small step is important. As I say, to my patients, if I want to go fast, I'm going to be slow. I'm going to take it step by step. So if I want to go to a place quickly, I'm going to take it slow, because that gets me where I want to. If I go fast, it feels like, oh, I don't know where I'm going. I got to go over here, got to go over here. Scattered, methodical, slow, but purposeful, you'll get where you're going. So just those small changes. I don't know if that answered the concern on any, because we all have our friends who are just not like, oh, you kind of want to shake them. And yet they have a right to be who they are and make the choices that they think. So
Well, I come from the philosophy it's better to know than not know. And you mentioned hormonal therapy.
mhm.
because we're gonna be running out of time soon.
Oh,
But
sure, sure.
can you expound on a little bit on the, how does a woman know at some point, I mean, the woman's feeling different to
Mhm,
start getting on the hormonal therapy, and
mhm,
how do you test for it? And
mhm,
I know, because I've been on it myself off and on, and I'm not on it right now.
mhm.
I couldn't find doctors who could regulate me and monitor it, and how often do you need to be monitored, because as your levels of different hormones drop, you're going to have to like increase some
Test,
things, decrease some things, so you're in balance, otherwise you're really out of balance. So
which can be its own problem. Yes. So when the hormones are out of balance, that creates its own problem. So for a woman for hormone replacement therapy, the first thing I address is that hormone replacement therapy does not cause breast cancer. Okay, that has been proven through the follow-up studies. So the history of hormone replacement therapy is the Women's Health Initiative. This came out right in my residency, and I literally remember taking women off hormones, and they were miserable. So it's been a number of years, and we've had a number of follow-up studies. And the studies show that with hormone therapy, the women did not have increased risk of breast cancer. 1 out of 100 or 300, 1 out of 1,000 had an diagnosis of an abnormal mammo, which did not translate to breast cancer. So the reality is hormone replacement therapy will not cause breast cancer. That's the number one concern for women.
right,
Then we
that's
talk
what
about then we talk about, well, is this a fit for you? If a woman's had breast cancer, it may or may not be one for her. If a woman has some condition that estrogen makes it worse, well, obviously we're not going to do that. But those aren't the typical women. So how will you know if you need your hormones? Well, I had a woman just the other day said she cries all the time. She gains weight all the time. She's irritable. She's tired. She's brain fog. She can't think. She can't remember. She can't sleep. She can't. She came to me because she thought her thyroid was abnormal because she has a history of thyroid issues. And I had to break it to her that her thyroid labs were absolutely pristine. Your hormones are all messed up. Please go get them checked. She ended up crying because it's like, yes, I believe you. All of this is true. You are not crazy. You have hormone issues. So you're 43, you're 40, maybe even 38. You should have some of these things going on. Go get your hormones checked. Now, we do check them if you're still cycling regularly within a specific time that we mark for reference. Regardless, if you are cycling and you think these are going abnormal, go get them checked, see what they are. Literally, women can have January, normal cycles, feeling fine. And 6 months later in July, we retest and they have dropped off the cliff of hormones. They don't make any anymore. It can happen that fast. So if you have a question, and these are non-specific symptoms, yet clustered together, they usually point in a certain direction. Go get them tested. So they test and you're like, okay, are you candidate for hormone replacement therapy? You can be a candidate for hormone replacement. You can restart HRT within 5 to 10 years after ceasing of your menses. So your risk for things are still minimal for that. What's the risk? It's cardiovascular disease, a heart attack or stroke. So what the WHI did was they took a bunch of women who were postmenopausal, like 5 to 10, 15 years. They gave them Provera, which is a synthetic estrogen and a synthetic progestin, not progesterone, not estradiol, and they see what happened. And they give it at pretty high doses. Well, women had a higher incidence of heart attack and strokes.
Mm,
Women themselves actually had hypertension, they were smokers, they were obese, they had all of the risk factors. But nonetheless, what happens if you give estrogen to a woman is that they become a little bit more sticky. And so with that stickiness, you have increased risk of clotting. That clotting then presented as heart attacks and strokes. So if you're in that window, then physiology, your body can still manage those hormones. And then at that point, it's just giving estradiol, I give progesterone, and then we measure, we see how you're feeling. And over time, you measure it at least once a year. Any adjustments, you follow it up. And then at some point, the testosterone will start to drop. We start giving that, see how they feel. And then it's kind of a maintenance. I have a woman who's, oh gosh, she's 72. We've adjusted her hormones a little bit, but she feels wonderful. And she's just amazing woman. She's like one of my heroes. So that went into a little depth about HRT, but I tend to go into a little depth. So I'm an educator at heart. So I kind of want to share the news.
Well, it seems like, when that menopause happens and there's dramatic changes, there's personality changes, like you said, there's insomnia, depression, um, not feeling, you're feeling fatigued, not feeling the energy that you have.
Yep,
I mean, that's a major shift for women.
it can be.
And how, I mean, basically taking the hormones then can, help you kind of, even if you can't get back exactly to where you were when you
Right,
were in your 30s
right.
and 40s, but at least you can feel a lot better. So
Yes.
you're saying that now it's safe, they found it safe to stay on those
Mhm.
HRTs, because I was told, years ago, like, yeah, the heart, breast cancer, heart disease, whatever, we heard so much about that
Mhm.
that it scared women off, uh,
Absolutely.
especially women, who now are a bit, the older set, that we had to stop taking it because we
Yeah.
were scared, like, oh,
Yes.
I don't want that. I don't want a heart attack, or,
Right. And now that's contributed to the rate of osteoporosis.
oh, I see. So
Which
it's all
drops in
because it was all tied in,
It's all
not
tied.
having the correct hormonal balance.
So we
It-
talked about the risks of hormone. What are the benefits? The benefits are maintaining at least your bone, so you don't have accelerated bone loss. You likely have a better profile, lipid profile, so your risk for cardiovascular disease will be lessened, although I don't have any statistics on that. My theory also is that the cognitively you will be better off. Women are what 2 times as at risk for Alzheimer's disease than men, and so they are just sort of quality of life things, but they're hard measures for me that make a difference. Thin bones, heart attacks, and thinking. So those are like 3 things that I believe, and I know with osteoporosis it does, but I believe with heart disease and cognitive decline, that estrogen has a positive impact on that. So that's a positive aspect of HRT. Mhm. Besides feeling good, which is sort of that neighbor, that's that mojo.
And are you measuring these hormones through blood tests or through saliva?
Yes, the standard of care is with blood test, and that's the world that I live in. And conventional world is the standard of care. There will be other providers who use saliva. It just hasn't been validated as a valid method in the conventional world. And so, since I live in that world, that's the standard I use. Mhm.
It's interesting because, there are not that many functional medicine doctors like yourself. Um, can you request, if you go to your regular doctor, or did you have to go to an OBGYN to get the hormonal, the tests and get on the hormones? Because I've tried with an OBGYN and she still didn't get it right. And I still felt like I was out of balance. So I just kind of gave
Oh,
up. So
yeah.
if you're not able to get to a functional medicine doctor,
Mhm.
how else can you get that kind of therapy and get that kind of help if you're
Right.
older?
So absolutely go into your healthcare system, your primary care provider. That would be the first level. I want my hormones checked. And do that. I'm complaining of XYZ. If that doesn't work, yes, you can go to an OB-GYN. Most OB-GYNs will do that. And if you're not getting any response, be persistent. Ask another doctor, go to a different doctor. They have a recommendation for an OB-GYN who does that. There are companies out there who specifically do hormone replacement therapy, pellet therapy, those kinds of things. You can go there, but I would do kind of a note of caution with that. And just educate yourself, read, ask, see what it is. If you're interested in a functional medicine, please go to ifm.org and put your zip code in the find a provider tab or click or whatever, and you in your area will find your both those that have been trained under functional medicine, but those who are certified. I would personally, with my bias, send you to a MD or a DO, especially for women over 50, because there are likely the other health issues involved. And that's our training. Our training is all about diseases. And so we can incorporate and integrate the functional to the conventional. Mhm.
We're running out of time, and I wanted you to kind of give an overall statement to
Ah,
our listeners out there to help them, some,
yeah,
tips or things that
yeah,
they should do right now that can help them. So
right.
what do you suggest, or what do you suggest we do to help us as aging women to
Mhm.
live better lives?
The first thing is to be curious about your life. What is going on? And not without judgment, without a reason why, without the story. Just go, I'm curious. How is my day? How am I feeling? I'm curious. When I eat this, this is how I feel. I mean, look out the day. Does that make me feel good? Do I need to go outside? Just be connected to your body. Your body is your nervous system, and your nervous system is that portal between your brain, unconscious, conscious, and your body. So tuning into that will allow you to get signals that your body is trying to get to you, and you'll tune it in. So just be curious. And if you just do that one thing, a healthier choice, that's that one healthier choice you didn't do the other day. Awesome. Great. Celebrate that. And I think if this does resonate, if you do want to pursue, there are a number of books out there that are really good that can start you on the path. Again, ifm.org will have lots of resources to read. Find people who are trained functionally. I'm again biased to Institute of Functional Medicine because I know their lens and their level of training. And just take a deep breath and say, yes, I'm worth it. Yes, I can do this and I will do this. Pull in support. If you need friends, a family to go help me with this, help pull in that support. There's, I've come to realize with doing some reading and doing, looking at women's health and leadership and all this other stuff. And I've come to realize that health and being well for women isn't a health issue. It's a women's issue. Because if you can't have your health, if your well-being is off, you're not going to perform in your job very well. You're not going to take care of your family, and you're not going to connect to your community, and you're not going to do your purpose because your health now is bigger and is undermining those. So health isn't just this separate siloed thing. It is for women a woman's issue. There you go.
And I agree with you. I think a lot of women, when, especially if they've raised a family, they have put all their energy and time into raising a family. And then when it comes to themselves, they've neglected themselves. And so it's another way, once, the family is off, the empty nest, and they have to realize, like, now they have to, they should have been taking care of themselves all along, but now they really have to take care of themselves because, it's about nurturing yourself. You neglected yourself. Now you have to kick in and start paying attention what's going on with your health so you can live, your later years of life in a
Right.
much healthier way and
And
enjoy life.
all, yeah, and all of us make choices in the past that we wish we hadn't, and we made choices in that time with the best knowledge and our best resources that we could. And so we can look at our past and go, yeah, I could have done different, and that's okay because you can't go back and change it, but don't carry the burden of guilt or judgment with it. Just say, okay, those are those choices. I wish they were different, but now I'm in this moment, I can make a different choice that impacts how I will be in the future. And so it is just embracing that I want to feel better, and nobody's going to make me feel better unless I start to make myself feel better. And so and that's valuable. That's worth it. there's your whole life gets better, your relations get better, all the connections get better. And so yeah, just look in the mirror, see what needs to be done, raise that awareness, bring that support in, and just make those little changes. And that's the first few steps.
Now, if somebody has other questions that are go beyond what we've talked about today, is it possible to reach out to you, and how would they do that?
Well, I can't answer specific health issues because unless you are my patient directly, and even then, I have to, there are HIPAA laws about what I can talk about. So I can't answer specific health directions, but I can educate. So I will point people to my website will be building out all of this information. And then other marketing and other things that are about to come in the next month or so. So you got me right on the edge of all of this. I love it. It's propelling me and giving me the little nudge and courage to put myself out there and start really putting this information in and letting women help themselves. Mm-hmm. Mm-hmm.
And Terri, would if I wanted to find your website, I just type in Terri.
Terri Pena MD. So TerriPena.com.
Okay, great.
And my socials are just that, Terri Pena. Terri Pena MD at Facebook, Instagram, and X, formerly known as Twitter.
Excellent, excellent, because I think there's a lot of women that will be doing more research after they've seen this show. And it's nice that you're able to, encourage them to go ahead and contact you or get some more information, because once they learn, that they're not the only one going through what they're going through, you know,
No, they are not alone. Mm-mm.
yeah, they're not alone. So that's great.
Mm-hmm.
So I really, really appreciate you being here and talking to me today,
Well, thank you
and
for the invitation, Eileen.
educating us older women about what to do and how to take care of ourselves better. And that there are resources out there. And like you said, there is, I love the 3 pillars that you mentioned, the 3 pillars to taking, care of all those 3 pillars, because we cannot just look at, just one thing at a time, as what traditional medicine has geared us to do, but
Right.
it's all a systemic, um,
Yes.
interaction.
It's all connected. It's all connected.
Well, thank you so much, and
You're welcome.
we'll probably talk again.
All
Okay.
right. Very good. Thank you.